Hey, hi, good evening, everyone, and welcome to the UP Community Health Town Hall. It's great to have you with us tonight. We're broadcasting live from the Michigan Tech University Student Development Complex. I want to welcome all of our viewers that are joining us on the Zoom webinar and on social media on Facebook Live, and all the listeners tuning in on a whole suite of radio stations across the UP, including 97.7 The Wolf, 98.7 The Rockin' Eagle, 105.7 Eagle Country, and Q107 in Marquette. It's great to have you with us. I think our coverage tonight is across the UP from Newberry all the way to Ontonagon and everyone in between that's joining us virtually. Our topic tonight will focus on some of the health needs and challenges for Upper Peninsula region. We'll also touch on some of the ways that we can target solutions to address those problems. In just a few minutes, I'll be joined by my colleague and co-host for tonight, Professor Kelly Kam, along with a panel of experts here to provide information, offer recommendations, and importantly, answer questions that you might have. Now, the goal of the Town Hall series is to help increase awareness about community health and preventative health issues and how importantly they impact you and our entire Upper Peninsula region and community. Before we get started, we want to recognize some of our sponsors, partners, and friends that have helped organize and put on the Town Hall series. Those include both of our universities, Michigan Tech University and the Health Research Institute, along with the Northern Michigan University Center for Rural Health. We want to say a special thanks to UP Health System Portage for their continued support, as well as two health foundations, the Michigan Health Endowment Fund and the Blue Cross Blue Shield of Michigan Health Foundation. Finally, if there's any community members, friends, family members, or neighbors that can't tune into the broadcast tonight, it is being recorded. It will be on ABC 10 this Sunday at 12 p.m. Eastern. It'll also be posted to our Michigan Tech University YouTube website, YouTube channel and website accordingly. With that in mind, I want to welcome in Kelly Kam, who is an endowed Portage Health assistant professor here at Michigan Tech University. She's an epidemiologist by training. So Kelly, good to be working with you again. If you can just let us know who's here tonight and what are some of the topics that will be covered, we'll get ready and get the town hall started.
All right, so just a technical issue. I'm not sure the blue box is still showing up. There we go. Okay, so it's been a little bit since we've done this. It's exciting to be back and to have a little bit different, not being focused on COVID so much, but many of the other health issues that are affecting our community. So we have a panel of 5 different people from across the UP, and we have a guest from downstate as well. So we have Elise Burr, who's the director of Northern Michigan University's Center for Rural Health. She'll start us off. And then we're pleased to have Dr. Robert Van Houw, who's the medical director for a couple of different health departments across the UP. So the Western UP Health Department, as well as the Iron Dickinson Health Department. Then we have Ray Kari, who's the Chief Administrator Officer for Aspirus, Iron River, and Ontonagon Hospitals. So she's got quite a bit on her plate as well, who will be able to talk about. So Dr. Van Houw is going to speak about the UP Community Health Needs Assessment, and then we have several speakers on to talk about how that information is being used. So Ray will be speaking out from the healthcare perspective. Then we have Andy Chosa, who's a grant administrator from UP Healthcare Solutions, to talk about it from the community perspective. And Dr. Myra Teta, who's a senior program officer for Blue Cross Blue Shield of Michigan Foundation, will be able to talk about it from the foundation's perspective. So excuse me, I'm a little out of practice with doing this.
Great, Kelly. It's really good to be working with you. Our last town hall, our COVID-focused town hall, was in April, so we will give you the benefit of the doubt. We've had a little bit of a summer break. We're excited to be back. And next, we'll welcome in Elise Burr from the Center for Rural Health at Northern Michigan University. Elise, good to see you again. And I know you're going to help us kick things off and provide some opening remarks. So we'll turn it over to you.
Thank you, Steve. Just happy to really be partnering between the two universities and having Michigan Technological University and Northern Michigan University working together to really expand what was previously a COVID-focused town hall series to being more of a regional UP community health town hall series. I think the geographic expansion to include the entire UP is going to be beneficial for a lot of individuals. And I really look forward to all of us partnering with additional organizations and agencies over the next year on the series.
Okay, thanks, Elise. And next, we'll welcome in Dr. Robert Van Houw, who is the medical director for both the Western Upper Peninsula Health Department and also the Iron Dickinson County Health Department. Dr. Van Houw, welcome back to the town hall. You were on here a number of times over the past couple of years, so good to see you again. And we'll turn it over to you to talk about the health needs assessment, what that is, and importantly, what are some of the findings and how we can develop some solutions to address some of those issues.
Yeah, well, this summer we released the report of the 2021 Upper Peninsula Community Health Needs Assessment. The Community Health Needs Assessments came out of the Affordable Care Act, where it was required for nonprofit hospitals to do a community health needs assessment on a regular basis about every 3 years. In 2017 and 2018, decided to have the entire Upper Peninsula be part of one assessment, and this is a continuation of that. It contains a lot of data that is collected from other sources, such as vital statistics and then national surveys and state surveys, with a focus on information that can be at the county level that we can use here in the Upper Peninsula. The report talks about demographics such as age and income. It also has a chapter on maternal and infant health, as well as adolescent health, contagious diseases, also morbidity and mortality, as well as the healthcare access, and also separate sections on mental health and substance abuse issues. The big thing that we did is we did a survey of people from each county in the Upper Peninsula. We sent about 1,700 surveys to each county, and we had people complete those. That same survey had been done in 2017, and so we were able to compare our results in 2021 to what happened in 2017. It's based on the behavioral risk factor survey that the CDC sends out, as well as the state sends out. So we're able to compare our local numbers to what was happening at the state and national levels. The other thing we had was we asked for people's input on how important they thought 16 different health priorities were. And so we got useful information on that as well. There are several interesting findings. One is that the Upper Peninsula has a very high rate of maternal smoking. We also have a very high rate of neonatal abstinence syndrome. We also have an aging population, so we have increased mortality and morbidity secondary to that. We also found out that since the last survey, the number of people who admit to smoking marijuana in the past 30 days has tripled. Part of that may be because marijuana was legalized, so some people are using it more. More people are using it now than used before, but there may be more people who feel comfortable saying they use it now that it's legalized. We've also, one of the big surprises was that the number of people who saw access to mental health care increased substantially compared to the previous survey. As far as the other priorities, most of them fell in importance, but this one had a pretty marked rise. One of the other things that we saw is that COVID had a huge impact over the course, and it's kind of hard to talk about what's happening in the community without talking about what COVID did to our health situation here. The numbers that we have from this are going to be helpful going forward. We can use this as a basis of determining where we've been and where we're headed and what progress we've made. We also can use it for developing health policies as well as implementing interventions. We also can use it for long-term planning. And that's about all I have.
Dr. Van Houw, we're going to start with a couple of questions, and I know Kelly and I have a few starter questions. We want to remind our listeners and viewers too, if they have questions, they can send those in two different ways. If you're on the Zoom webinar here, you can use the Q&A button at the bottom. If you are out there listening, we do have an email address. It's townhall2020@mtu.edu, and we'll do our best to direct the questions to the appropriate speaker. Dr. Van Houw, it is a pretty lengthy report that you mentioned. First question is, how do folks get a copy or get access, whether they're a community member, maybe an educator, or even older adults that might want to look at some of the findings?
Yeah, you can go to wuphd.org wuphd.org, and try to find the link for it. We're changing the link currently, so it's easier to have access to it. We also have access to 2-page summaries of what's happening in each of the counties.
Great. Then the next question, and I'll start with Dr. Van Houw and maybe even incorporate some feedback from Elise here as well. You did mention that the UP, one of the problems we face, and I looked at the report, is our population is aging and the number of adults over the age of 65 is higher than our state average. Can you elaborate a little bit, Dr. Van Houw, what that means for rates of other underlying illnesses and medical conditions? And then I'm wondering if Elise might come in and tell us a little bit about what does that mean for, as some of those adults might be working in healthcare and retiring soon and addressing some of the shortage of healthcare professionals that we have in the area. So it's sort of a two-part question here. Dr. Van Houw, could you elaborate a little bit?
So what happens as you get older, you're more likely to have a chronic illness. You're more likely to need assistance at home. And so there's more demand for that. The other thing that happens is if you have a flight of young people from the area, then you don't have a pool to have a workforce to take care of the elderly population.
Great, thanks, Dr. Van Houw. Elise, anything that you can add from really a workforce development? I know that's an area that your center is focused on.
Yeah, thanks, Steve. As Dr. Van Houw mentioned, just that we have to increase our workforce to be able to take care of an elderly population or an aging population. And we also need to keep in mind that our current structure of what we have might need to be expanded to be able to accommodate more elders coming in, into the future. So, I mean, that's something that economy-wise, people are paying attention to right now. And we really want to try to uplift the caregiver workforce overall and really help the state come up with a curriculum that's acceptable and reimbursable.
Great. Thanks, Elise. And let's bring Kelly into the discussion here as an educator at Michigan Tech. Kelly, where does the universities across the UP, what is their role in sort of helping increase and develop a more robust healthcare workforce with some of the health-focused degrees and programs that we have maybe across the region?
Sure. And I think this is kind of key and part of why we found it important to expand this particular format to be able to collaborate with Northern and Michigan Tech, is that we have limited resources up here and we can help not only train our staff, our students that are here and our workforce that is here so that they can stay here. But in order to do that and be cognizant of our limited resources, the best thing that we can do is really work across the universities at Michigan Tech, at Northern Michigan, at Lake Superior State University, including our colleges and community colleges like KVOCC, to really start to plan region-wide what programs we can make sure each of these universities are offering to be able to build our workforce from within here in the Upper Peninsula.
Thanks, Kelly. And one more question for Dr. Van Houw that's come in. We do have 2 additional radio partners that are coming on in the Keweenaw Bay Indian community area. And I'm just wondering if there's any specific information in the health needs assessment report that might be specific to Baraga County, for example. I know there's a lot in there, but for those listeners, anything that stood out that they need to be aware of?
There's a number of different areas that you can look at. We've tried to break down the data as much as we could to a county level. Baraga seemed to be a little younger. Also, there were some other issues that affected them more than other counties. So, yeah.
Okay, great. Thanks. Thank you, Dr. Van Houw. Just to keep us moving along, I think this is a great transition. We're going to welcome in our next speaker. So kind of shifting from the public health departments and sort of the purpose of the survey. And then we're going to welcome in a representative from Aspirus and their hospitals both in Ontonagon and Iron River area. We have Ray Kari here, who is the Chief Administrative Officer. So Ray, tell us a little bit about your role and how your healthcare system can use some of the data and findings here to help with improving patient care. And Ray will help you unmute here in just a minute. Bear with us just a moment. At the bottom here, Ray, there should be a, yep, there you go.
Perfect.
The platform's yours. Welcome, Ray.
Very good. Yes, like Dr. Van House said, we rely and really appreciate all the work that the health departments put into this community needs assessment, because we are required to do this every 3 years. And we get a lot of great data from this community needs assessment. The things that we have found and it's pretty consistent across the western end of the UP for the four Aspira systems. We kind of take this whole information and work as a group on it between the four hospitals. And the 3 things that we've come up with, we have certain criteria how we kind of go through that report. And the 3 things that we've come up with are mental health, substance abuse, and chronic disease. I think chronic disease kind of goes with the aging population, like you said. So it doesn't mean that we're not working on other things throughout the year. We still like to work on some things that we found with the smoking and those types of things. But these 3 things were the highest on our list for the counties that we serve. So a couple of the things that we're doing in the different areas for mental health, we're really working on improving education and trainings for suicide prevention, trying to get into the schools, collaborating with the schools, collaborating with the health departments in our areas to do those training sessions. We're working on an anti-stigma campaign. As you know, with behavioral health and mental health issues, there's a lot of stigma attached. So we're really working on trying to get a campaign out to address those issues. Senior wellness. We've just started a program up in the Ironwood facility, Aspirus Ironwood. That's a senior wellness program that really is a day type of therapy program that seniors can attend sometimes when they're going through grief or changes in what they are able to do, those types of things. You have some mental health issues or behavioral issues that you really want to address there. So we started a program there that's been very successful, and we're hoping to expand that throughout our other organizations. Substance abuse, the same thing, with lots and lots and lots on education. Trying to get out and partnering with the different foundations in the area, the different schools, different community groups to just get that education out on substance abuse. Also working on a self-referral process for individuals that really want to seek recovery. You know, lots of times there's barriers to getting into that access. So trying to figure out a self-referral program for that. And then working with support groups, trying to get those support groups up and going. With COVID, a lot of our support groups had to be put on the back burner. We're finally able to bring those support groups back up and really trying to get those moving forward. Chronic disease, we're trying to get from young to small involved in fitness centers or fitness programs. There's a lot of biking programs, a lot of outdoor activities, really trying to focus on those. We're starting a program just this month called Vertical Gardens in our hospitals that the employees can use we're growing lettuce and stuff that they can use for themselves. We can't use them for the patients, but that's also found to be not only good for healthy foods and chronic conditions, but it's also a good mental health thing. It gives the staff members a place to go and take a break and kind of just do their little gardening thing. And then doing a lot of work, trying to get programs up where I think you've heard about food as a prescription, you know, healthy foods, healthy programs with farmers markets in the communities, prescriptions for food, healthy food from your providers. So a lot of work with the different foundations. It's a lot of collaboration. This isn't just things that we're doing on our own. It's collaborating with the health departments, with the foundations, with community groups. The more people we get involved, the better chance of succeeding that we have.
Thank you so much, Ray, for that information. Before we have a couple questions for you, you really highlighted a lot on some preventative things that Aspirus is doing. I want to loop back to Dr. Van Houw. Dr. Van Houw, in the UP Health Needs Assessment report, prevention was a sort of a key strategy moving forward. I'm wondering if you can just maybe touch on that from the findings that you have in the report, the key aspect of prevention that Ray just touched on.
So some of the things we looked at were like smoking rates and alcohol use rates, as well as how much people were exercising or how little they were exercising, as well as whether they were eating healthy or not. So those are major areas where we can have a baseline level of where we're at. And if we implement these preventive measures, hopefully down the road, we can determine whether or not we made improvement at a community level or not. So yeah, and there's also the various social determinants of health that we looked at as well. We found that income and education level were probably the strongest predictors of how healthy someone was and how healthy their behaviors were.
Great. Thanks, Dr. Van Houw. So we'll come back to Ray here. Ray, we talked a little bit about workforce development already, that some of our healthcare workers are aging into retirement. Elise mentioned, hey, we need more robust strategies to, and Kelly did as well. Are there, from a healthcare system perspective, how do we attract the students and retain and keep them here in the UP versus going downstate or down to Wisconsin? Are there incentives? Are there, how can we keep the good students from the area here to come and work for Aspirus and other healthcare systems as some of those healthcare workers are aging out, so to speak?
Yeah, Steve, as Elise said, that it's a challenge. We're struggling in all of our Aspirus and all of the health systems in the UP. I've talked to many of them, and we all have the same challenges. So we're trying to do unique things. We attend job fairs and just educational fairs up at Michigan Tech, at Northern. We're working in the community colleges, the Echo Gibbet Community College and Bay College, trying to get out there and just explain the different areas of healthcare, because it's not just nursing. I mean, we're struggling in lab, radiology, respiratory therapy, surgical techs. We're really trying to do some unique things, things that we haven't done in the past. Examples would be in the lab. We're working with biology and chemistry students that graduate, and we have the capability to train them in the lab. And if once they have that 4-year degree in chemistry or biology, they can then sit for their certification exams. So we're doing things that we've never done before. We also are really being aggressive in the market, trying to get retention bonuses, sign-on bonuses. You know, I think everybody in the UP's got that going on too. So just a lot of work, but trying to get out early into the high schools, into the community schools, you know, to try to get those kids to stay, because we find that if we can engage our local children, you know, that are in the high schools, if we can get those into the colleges that are going into healthcare, they stay local most often. They like the UP, they want to be here. So really trying to focus on that.
Elise, did you have a comment? You unmuted. Go ahead, Elise.
Yeah, I just wanted to add also that I think all the funding more recently that UP Michigan Works has received has really allowed a lot of apprenticeship type programs to be developed, and that the hospital and clinic systems right now have been more open to embracing those apprenticeship opportunities and shadowing experiences. So I really think that's going to pay off for us as well.
Yep, I agree.
And then I'm going to welcome Kelly. Kelly, I know that there's a National Outreach Day coming up in November. Did you want to, we're still in October, but did you want to give a plug for what you and your students are going to be helping promote in a few weeks?
Well, so there's a couple different things. So one is National Rural Health Day, I believe is November 17th. Is that
17th.
the correct,
Yep.
the correct date?
Yep.
So we're trying to get everything's always a little busy, but we're trying to get some students to be able to get out and not only promote that, but it's also the Physiology Fun Day with a PH. And so we're working within Steve's and my department of kinesiology and integrated physiology to try and get some of our students out into high schools, possibly into some other opportunities to not only get kids active and moving, but also get them to introduce of different things that they can do, different ways that they can be involved in health and healthcare. And like you said, stay here in the communities.
Mm-hmm.
We don't have any the details fully worked out yet, but stay tuned.
Good, yeah.
Great point, Kelly. And if there are any educators, high school teachers, K-12 folks that are on our listening tonight, please reach out to us at our respective universities if you'd like any of our students to do a virtual demonstration, visit in person. Kelly, we're really trying to reconnect with the K-12 schools, as that certainly dropped off during the pandemic. And as we build forward, community outreach is something that's really important. Ray, one more question that actually came in here. I think this is from a listener, a viewer that's come on the town halls before, or at least asked questions. They were saying one of the silver linings of the pandemic was how the healthcare systems here in the UP worked collaboratively to really address some of the pandemic concerns. As we move forward and think about some of the health needs that Dr. Van Houw summarized, do you envision continuing to collaborate with other healthcare systems or working more independently? That was kind of what the question was focused on.
No, definitely we have to collaborate. There is just no room to be working independently anymore. So we collaborate amongst our own people, but we also collaborate with the other people throughout the UP. I mean, we do a lot of networking, trying to find best practices, how we can do things more efficiently with the staff that we have. Just trying to get ideas on how we can do our work differently, because it's going to be a while before we can get the workforce up and trained in and ready to go. So we have to look at things differently. We have to collaborate. The community needs assessment drives the different types of services that we try to bring in too. Like we look at it like behavioral health or mental health is one of our three top that we're looking at. So do we need more behavioral health providers? We need to look at ways to bring telehealth to the behavioral health realm. So we are collaborating with pretty much everybody across the UP and trying to see how we can do things different. Okay. COVID changed everything, so yep. It's a whole new game.
Okay, thank you, Ray. I just want to pause here for just a minute before we go on to our next speaker and welcome any new viewers or listeners that might be tuning in. We're here for our UP Community Health Town Hall. I keep wanting to say COVID-19 Town Hall, but Kelly will help me autocorrect there. But we're talking about some of the health needs for the Upper Peninsula, and importantly here, touching on ways that we can target those needs and find solutions. If you are out there joining us and you're listening on the radio, and you want to see some of the visual content, we're waving right now. A good way to do that is you can hop on over to thewolf.com 977. Once you're on their website, you can just scroll down and click on the Zoom link to join us on the webinar under UP Community Health Town Hall. We do also have an opportunity for us to answer questions that community members have. You can send your questions two different ways. You can email us at townhall2020@mtu.edu. You can also put a question if you're on the Zoom webinar here in the Q&A button at the bottom. We're going to keep things moving along and welcome in our next speaker. We have Andy Chosa, who's a grant administrator with UP Healthcare Solutions over in Marquette. So Andy, it's great to meet you. Welcome to the Town Hall, and tell us a little bit more about your organization and importantly, how you use some of the data out of the health needs assessment.
Thank you, Steve. Like you said, my name is Andy Chosa. I'm the grant administrator for Upper Peninsula Healthcare Solutions. UPHCS is a nonprofit network of hospitals in the Upper Peninsula, and we work to develop programs and services that operate across health system jurisdictions. So a lot of the times, the types of programs that we do will be sort of focused on different geographies and multiple county regions in the UP, but exclusively in the UP. So I am the grant administrator. I write grant proposals and I handle all of the progress and feedback and evaluation for the grants that the organization does receive. So I reference the community health needs assessment frequently, all the time. I have referred to it as my Bible. It is about as thick as a Bible, 450 pages. But there's sections in there that I refer to more often than others. Specifically, there's the demographic section and access to care section and maternal and child health sections. A lot of that information is widely and publicly available, but it does save me time to be able to have it all in one place, sort of aggregated. So when I'm putting together a proposal and I need to know, populations and demographics within a certain county, it's nice to be able to just sort of snap my fingers and have that at my fingertips. There is a section on adolescent health. I don't use it quite as much because we don't target that specific subpopulation as often in the work that we do, but when we do, it's nice to again already have a lot of those tables and data sources available for us. There's a chronic disease and mortality section. It's very rich data in this section, specific to the local, and like Robert mentioned, it's by county, which is a little bit tougher to sometimes get your hands on from other data sources. There's also some analysis that are done in each at the heading of each section when they're going through chronic disease states and sort of what each region is facing, what our communities are facing in that area. There's some nice longitudinal analysis that tell us kind of where we were and where we're heading. But the real meat and potatoes of the community health needs assessment is that regional adult health survey. There's really no other place to get that type of feedback from our communities, and to have it that specific to the county level. So I'm going to make my appeal right now to all the listeners that if you're asked to take part in the community health needs assessment in the UP, please, we need to hear from you. It's that we can't find data like this that's segmented down within geographies, and then also sub-segmented by age and education level and income. It's really the only way that an organization like mine that's covering the 15 counties of the UP, it's the only way for us to know where to put our limited resources and what the priorities of the region are and what they should be based on the data. So things like, especially that income sub-segmentation really shows us some disparities between not just low and high, but also like the middle. So there's some surprising disparities. I was just looking at it, and you look at PCP visits, and you see the people that have visited their PCP in the last 12 months. The highest income bracket had the highest rate of having visited their PCP in the last 12 months, and the lowest income bracket has had not quite as high as the highest, but higher, and the lowest rate was actually in the middle. So that kind of tells us something about where we needed to focus our resources and the type of work that we're doing. Also, Robert mentioned the issues and priorities survey. That we can't find that sort of information either. It's broken down by county, so it gives us an idea of not just what the regions, like a region-wide priorities are, but also breaks it out by county. So on the west end, they might be wanting to focus on one issue. East end might want to be focusing on another. That gives us an idea of how we should be deploying our resources, and it also tells us gives us an idea of what kind of support we're going to get in the local communities when we're trying to develop relationships with other organizations to implement interventions and solutions. So how I use that data, primarily it's to establish the need. A lot of the work that we do, as I said, is kind of focused. We might have a 3-county region, or we might say the whole west half of the UP, starting in Marquette County and everything west. It allows us to subsegment our statement of needs down to the county level to show that it's not just a need in the state or in the Midwest. It is a specific need in Keweenaw, Houghton, Baraga, Marquette, being able to draw to delineate that shows that we have a deep understanding of the communities that we work with, and the granting organizations tend to prioritize that, because it shows that not only we have that understanding, and that that we have the capability to focus our efforts on addressing the needs in those communities. It also helps us find the right partners. So if we know that a need is high in a certain region, we can go into that region, find out who else is working in that region, and see what we can do to support, make sure we're not duplicating efforts, make sure anything that we're doing is working in synchronously with existing efforts. It also does the community health needs assessment gives us a lot of insight into which specific health needs are sort of need an intervention, or can use an intervention, or something where we can have the most amount of impact with the efforts that we put forth. Talking about maternal infant health, we see that NAS is high throughout the UP. So over the past 5 years, that's been an organizational priority, because we know that one is a very difficult problem to address, and we're constantly reaching out, finding more interventions that we can implement, and we're testing them out, and we're putting them out into the communities in an effort to see what works, and then when we find things that work, replicate them across the region. Now, it's kind of limited in its evaluative power, just because of the timeline on the community health needs assessment is kind of long, that 3-year time span for a lot of the types of projects that we're doing. Our funding organizations want to see what our outcomes are, what our impact is, a little bit sooner than that. However, and it's hard for us to correlate the what our interventions are when you're looking at population level health outcomes. But what we do see is we see trend lines. So we'll see if we're the things that we've been putting our resources towards over the past couple of years have been I mean, it may not be specific to the work that we're doing, but we can at least see if that issue is trending in the right direction or not. And that tells us, okay, do we need to keep pouring more resources into it? Do we need to change up our interventions? It gives us some guidance for reallocating those resources in a way that's strategic and will have and efficient. It also gives us a little bit of a direction of the wind as far as like what the public perception is of the types of issues that we're addressing, and gives us an opportunity to see what types of things are going to gain the most traction, because those things that are important in our communities, and also we know that there's data showing us that there's a need for that in that community. Those are the ones where we know our interventions are going to have the greatest amount of impact, because it's going to have the greatest amount of support. So it's serves as both of a roadmap for us, and also a bit of a yardstick.
Thank you, Andy. And just to maybe pull everything together here, you really talked about the dissemination of the findings, how you use that to really apply for grants. Then there's the implementation, and then ultimately the evaluation if that intervention or program is impactful. And can you just elaborate a little bit more on where do the community members that are either benefiting from that intervention or that program, can you just talk a little bit more about how you interact with them to really determine if it's working? Should we put more resources? So kind of that tail end of the whole continuum there.
A lot of the work that we're doing is we're working at the clinical level, a little bit in the hospitals, a little bit in our community-based organizations to implement our interventions. So we work with My Michigan Health, Sue, on some interventions for maternal and infant health. And we've seen that it being a priority in their region, it was a need in their region, it was a priority in their region. We approached them with some resources and some potential interventions. They implement those interventions, and then they feed us back the data for us to show to the funders to say, yes, this intervention is working. I hit on that one all the time. It's one of my favorites. It works. It's working, and we want to replicate that. But in other cases, it comes back and it says, well, the line stayed flat. We need to change something up on this intervention. So it's usually that's kind of how we operate, is we work with a local partner, implement, and then receive that evaluative data back. And that tells us whether or not that intervention is working. And we try to be nimble and pivot if it's not working.
Great. I want to sort of connect the dots here a little bit. Ray really emphasized the point earlier about the importance of these robust partnerships. Can you tell us a little bit more about some of the specific partners, folks that you collaborate with? I know Kelly's representing universities here. Elise is as well. We do have some students listening tonight. There are student organizations, but maybe some partners that you've worked with in the past. And are there any partners that you'd be willing to work with in the future, I guess, to target some of these needs?
I think pretty much everybody in this room is representing an organization. If you haven't worked with us directly, then your organization has worked with Upper Peninsula Healthcare Solutions in the past, and a lot of times it can get super specific. I know that Blue Cross Blue Shield Michigan Foundation we worked together on a diabetic retinopathy project where we're implementing some handheld devices so that those retinopathy tests were being done in the PCP offices rather than having to go to the eye doctor's office. Having one appointment instead of two appointments is more convenient, and therefore people were getting it more often. And some of the outcomes were very specific to like, oh, this person got that scan done in their PCP's office, never had the scan done before, and it prevented a vision threatening disease from developing, and it wouldn't have gotten caught but for that intervention. We work with essentially all of the health systems in the region, clinics we reach out to. Sometimes, a lot of the times, they have priorities that are just so all encompassing that they can't engage with us all the time. But when one of their priorities aligns with one of ours, we want to make sure that they kind of know that these are things that we're working on. So even some of the private clinicians in the region, we're working with, and it might be we're just inviting them to come to a webinar or participate in a collaborative and give us some feedback and let us know what they need. During the pandemic, we worked with the Michigan Health Endowment Fund. They gave us some resources to expand telehealth capacity throughout the region. So it was kind of I think it was even called the Rapid Response Program, where it was just, here's a whole bunch of money. You need to get your clinicians up and running. So we with dozens and dozens of clinicians all came online to be able to do telehealth all at the same time. So we had to deploy hardware, we had to deploy training, we had to make sure that they had the right software, we had to make sure that there were billing processes in place so that they could sustain this work as it was happening. And it was all very like, okay, this needed to be done yesterday. So yeah, health departments, healthcare providers, but also other community-based organizations, Great Lakes Recovery Centers, Little Brothers Friends of the Elderly, UPCAP. Those are all organizations that we work with, and we make sure that we're having these connections so that when a organization comes to us, they're plugging into a network.
Well, keep up the great work, Andy. Thanks for that very thorough overview. I think this is a great segue and welcoming our next speaker. We have Dr. Myra Teta, who's the Senior Program Officer at one of the health foundations you mentioned, the Blue Cross Blue Shield of Michigan Foundation. So Myra, great to see you again. We recently met in person for the first time and connecting virtually here. Welcome to the town hall, and just tell us a little bit about the role of health foundations like yours and others kind of on our theme tonight of looking at some of the health needs assessment data, and importantly, trying to think about implementation, evaluation, and really targeting solutions. So, Myra?
Yes, thank you so much, Steve. And as you mentioned, at the Blue Cross Blue Shield of Michigan Foundation, we're really committed to improving the health and wellness of Michiganders just across the entire state. And we're really excited about the Community Health Needs Assessment because we know that it really is a guiding light that really illuminates the things that matter in the community. And as Andy said, we both thank the Western UP Health Department, but we really thank the residents who took the time to fill out the health needs assessment, because these are the things that were identified that residents said these are issues that really we care about and impact our day-to-day lives. And so we are thankful to be able to partner to help to disseminate the health needs assessment to multiple communities, whether it's healthcare, it's researchers, and then also community-based organizations to learn about what's going on and then also to start to think about strategies. And so when we think about the unique roles that individuals share, whether they understand the research or they're on the ground in community-based organizations, or they have the healthcare resources, we know that when we join together, that it's really an unstoppable force for change. And I'm so thankful because in philanthropy, we have such a humbling role and a humbling responsibility to help our community. And so we are so proud to be able to collaborate with the Michigan Health Endowment Fund, the Portage Health Foundation, the Superior Health Foundation, other foundations, and then also the community foundations across the Upper Peninsula to bring together multi-sector experts to help improve community health. And so many of these topics that were mentioned, whether it's workforce, we've done work with NMU and health sciences training, also caregiving as well. We've done work on mental health, on suicide prevention, on chronic diseases, and then also on SUDs as it relates to recovery communities. And so as we're hearing of these topics that matter, whether it's in the community health needs assessment or also when we're just on the ground, we're providing funding and providing programs to understand how we can impact community health and really move the needle forward to having healthier lives for all of us. So thank you.
Myra, you're not off the hook yet. We have a question here. We were going to save your part for the closing remarks, but we have a little bit of time here for some more questions. I know in the health needs assessment, there is some language about health disparities. And I'm just wondering if you could elaborate a little bit and inform our listeners if we talk about health equality or health equity, but just this notion of health disparities as we're all learning more about this. It's in the report. And just from your perspective from the foundation, if you could just tell our listeners a little bit more about why that's so important to make sure we're addressing many of the health disparities that we have, whether it's in our region or the state in general.
Yes, and so health disparities, when we think of even how we're born, all of us are coming here as babies, and we're at that point we're all children. But at the same time, not all of us have equal footing when we arrive on this earth. And so when you have health disparities, for some it is, as was mentioned earlier, we know that income and education can help an individual in terms of their life expectancy. We know that access to medical providers and transportation also impact whether or not you're able to see a medical provider when you have the need, whether it's insurance. We know that oftentimes our employment is connected to whether or not we have health insurance. And so all of these different health disparities we want to address. And so even a couple of years ago, the Blue Cross Blue Shield of Michigan Foundation, we made a very intentional effort to make sure that we were including health disparities and health equity across our grant programs. Because as a matter of fact, a few years ago, I was at the American Public Health Association conference, and there were signs that talked about how your zip code matters more than your genetic code as it relates to your life expectancy. And so when we think about that, it's very important for us to be even more intentional of thinking about place-based work and how our place impacts those health disparities that then impacts our livelihood and how happy and healthy we are.
Thank you, Myra. There's a question that came in here via email. I want to start with Dr. Robert Van Houw, who's the medical director at the Western UP Health Department. Dr. Van Houw, the last time this report came out, correct me if I'm wrong, was 2018, correct? And we've had the COVID-19 pandemic sort of in between the two reports. How much has the pandemic impacted the overall health of the UP? If you could just elaborate a little bit more, and then I want to loop Kelly in. If folks have questions about boosters, things like that, where can they go to get information? So Dr. Van Houw, we'll start with you because I know that was one of the key parts on the main findings in the first few pages was the impact of COVID-19 on the region.
One of the major differences we saw is that the ability of people to get preventative care decreased. So fewer women were getting pap smears, fewer men were getting their PSAs tested, fewer people were getting those type of things done. Some of it had to do with the fact that physicians closed down their office schedules because they didn't want to have people come into the hospital, come into the clinic for fear that they would get infected or be exposed to COVID-19. So we saw a lot of major decrease in the preventative services that were being provided. So that's one of the major things. We also saw, at least nationally, we saw an overall increase in mortality. And if you take the number of deaths that we had that were not related to COVID, that stayed about the same as where it had been in the past. And then the COVID deaths were in addition to the baseline number of deaths that we were seeing in the past. So those are the two major ones that I would mention.
Thank you, Dr. Van Houw. Before we get to Kelly on the COVID-19 related question, I want to bring in Ray here from Aspirus. Ray, Dr. Van Houw mentioned sort of, not neglecting, but just sort of not coming in for some of the preventative or elective procedures. From the healthcare system perspective, is there a backlog? Are community members having a long time to get in? How do we catch up, so to speak, on the past couple of years on maybe some of those preventative and health screenings that patients missed?
So we really don't have a backlog. We're kind of back to where we were before. Last year was a kind of in between year. We don't really have a backlog, but we're still seeing a lot of people that are afraid to come in. They're still leery of coming to the doctor's office. They don't want to be around people that might be infected. So we're doing a lot of trying to educate on that also, as to make sure we're doing a lot of phone calls to people if they haven't been in for their mammograms or some of their annual checkups. We're calling them to just remind them and let them know that it is safe. We have all the precautions, in place, and that they really need to get back into their routines that they were before.
Okay.
And I think by having some of those support groups back too, in those people getting together and being able to talk and talk about the different fears and concerns they have about healthcare is kind of helping people get back into the swing of things.
Great. Thanks, Ray. Kelly, we'll bring you into the discussion here. There was a question if I need some guidance on the COVID-19 booster shot that's now available. Could you just give us a quick snapshot update?
Well, the problem is it gets kind of complicated. And so I would definitely recommend call the health department, talk to your care provider, your primary care provider. CDC does actually have a pretty good little quick thing to find out when you should get your boosters. We absolutely recommend everybody getting their booster with the new. So there's been some confusion, I think, a little bit there with the new formulation of the boosters. You don't get a choice. If you go in to get your booster, the bivalent booster is the only thing that's available. So I've had certainly some questions within my own family. Should I get the original booster or the bivalent? That's not a question, because you're just going to get the bivalent. That's what's available, which means that it includes both the original variant, as well as the spike protein. So one of the important characteristics of the Omicron variant. So that has two pieces. It's similar to the idea of what our flu vaccines have, where they have multiple components to try and hit the most likely ones that are there. If it's been at least a couple months since you've had a booster, talk to your doctor or talk to the health department about whether you qualify or should be getting a booster with it. We're getting into the season again where it's cold and flu season. We're getting inside. That if you haven't had a booster, I definitely would absolutely recommend you seek out a booster, find out more about it. The CDC has, like I said, has this little find out if you should get a booster. If you look under, so cdc.gov, search for COVID-19, they'll have a tab that says vaccines. And it just has a few questions that'll say, how old are you? What was your original vaccine and when did you get it? And it'll pop up with some quick information. But I really would encourage everybody to reach out to their primary care provider. We still have it circulating. It's not gone. And the vaccines will help reduce symptoms. We are seeing reductions in hospitalizations and deaths because of the vaccine. So it's important to have.
Thank you, Kelly, for that quick update. We have just a couple minutes left here, so I want to give our three featured speakers here just kind of a last second take-home message for our listeners and viewers. So Dr. Van Houw, we'll start with you. I'll give you about 20 or 30 seconds. What's the main takeaway from your part today on the town hall?
I think we have a lot of information that we can act on, and I want to thank the people who filled out the survey as well. I think there's we need to go forward and use this information to develop our community health improvement plans, and that's the next step in the process.
Thank you, Dr. Van Houw. Let's go to Ray from Aspirus.
Yeah, I can just echo what Dr. Van Houw said, and we want to thank the health department for doing this community needs assessment. This would be a huge undertaking for the independent hospitals to kind of work through. They would never get as much data. It would never be as meaningful. So I appreciate that. It does give us a really good look at what we need to help our communities. That's our goal, is to be there to serve our communities. And this health needs assessment really puts us in the right direction.
Okay. Thank you, Ray. Let's go to Andy.
One more appeal for listeners to, if you're asked to take part in the community health needs assessment, is very, very important to us to not just us, but us, the royal us, the entire region of the UP. And while I got a second, a couple of quick suggestions for Dr. Van Houw, I'd really like to get those tables as a spreadsheet, if we can put those on the website, and also bookmark those PDFs so it's a little bit more navigable. That would make my eyes a little bit less tired.
Great. Thank you, Andy. I think Dr. Van Houw is muted, and for the sake of time, we can certainly follow up. And just to remind folks, community members, educators, researchers, K-12 students and teachers, community members, that website is wupdhd.org. Once you're on the page, you can scroll down and find the whole 500-page document, and they do have a summary as well. Kelly, we have a minute to go here. I'm going to give you any final words, and then I'll thank all of our speakers.
I think I would just reiterate what everybody else said, is that none of this could have been done without the participants that took the time to answer those questions, both in any of the previous iterations as well as this one. And we would encourage everybody to participate in future health needs assessment surveys as well.
Great. Thank you to all of our speakers that are on tonight. Thank you to both Elise and Myra for their opening and closing remarks. We appreciate all of our listeners tuning in. I just need to recognize the whole suite of radio stations here: 97.7 The Wolf, 98.7 The Rock and Eagle, 105.7 Eagle Country, and Q107. I hope I didn't leave anybody off. Thank you to both universities, Northern Michigan University, their Center for Rural Health, and the Michigan Tech University Health Research Institute. Our next town hall is coming up. We do the final Thursday of every month. That's Thanksgiving in November. So we'll be on, I guess, the first Thursday of December, December 1st, from 7 to 8 p.m. Eastern. The topic will focus on mental and behavioral health and well-being. So until then, have a great Thanksgiving. We'll see you in a little over a month. Good evening, everybody, and thanks again for tuning in.